Kendrick Bourne of the New England Patriots was ruled out pretty quickly today with a right knee injury. As of right now, it looks like sources are saying that initial diagnosed testing essentially point to an MCL injury. However, he's due to have that MRI tomorrow. Since some people may not be too familiar with the anatomy of an MCL injury, as well as some of the preliminary tests that can be done to determine if someone is dealing with an MCL injury, I want to go ahead and focus on that with this video today. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. With this channel, I take a look at sports injuries and I go over them so that they're a little bit easier to understand. I also talk about the relevant anatomy for that injury, as well as what that person should expect when coming to rehab. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have any experiences with these specific injuries, go ahead and comment in the comment section. So we see here on the injury video that as Bourne catches the pass, he's going to be pulled down into the turf. As this happens, it looks like that right knee caves in slightly, but as he's being pulled down into the turf, that's going to place a lot of stress at the knee. Here I've got a model of the knee joint, and so the top bone here, that's going to be known as the femur, also known as the thigh bone. That's going to come down and form the top portion of the knee. The bottom part here, we have this long bone known as the tibia or shin bone, is going to come up and form the bottom piece. Then as we go laterally or towards the outside, we have the fibula bone here. Now, there are four main ligaments that contribute to overall stability at the knee. The first one being that anterior cruciate ligament, or the ACL for short, located right in through here. For the sake of this video, we have the MCL, or the medial collateral ligament, which is located here on the inside portion of the knee. As we flip laterally or towards the outside portion of the knee, we have the lateral collateral ligament. And finally, as we flip to the back, we have the PCL, also known as the posterior cruciate ligament. We also have two other pieces of fiber cartilage located here and here. They are known as the medial and lateral meniscus. You can think of both of these essentially as shock absorbers between two bones. Now, anytime somebody's going to suffer an MCL injury, essentially what is going to happen at the knee joint here is something known as a valgus force. So anytime a person is going to be planted and there's going to be a force coming from the outside coming inwards, just like this, you can see that wants to separate that MCL. We can see right here at this moment on the injury video that as that right leg actually is planted and he's resisting being taken to the ground, that is placing that valgus force going through that MCL, or looks like a valgus force going through that MCL right there. Now, there are a couple other structures that can be at risk for damage essentially when in this valgus position. The first one being that ACL and that medial meniscus. Now, there is an instance where somebody can injure all three of these at once. It's called a terrible triad injury. As of right now, it looks like they are only thinking that the MCL is being implicated, but because we see that knee cave in essentially slightly as he's being pulled down into the ground, that causes us to essentially believe that some other structures could be involved as well. The MRI, of course, is going to tell us what exactly is going on with this specific injury, but there is an on the field or in the clinic test we can do to essentially rule in an MCL injury, and that's going to be known as a valgus test. So essentially what we're going to do is we're going to stabilize the person's leg, and as we do this, we're going to place that valgus force coming through the knee there, and as we do that, essentially we're going to see if this reproduces a person's pain and or if they have any laxity in the affected knee compared to the non-affected knee. If we reproduce pain and or there is some laxity, then that makes us believe we're dealing with an MCL injury. There is a grading system for these MCL injuries. There are grades 1, 2, and 3. In a grade 1, you're getting stretching of the MCL. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're going to be getting a full rupture. Anytime a person suffers a grade 1 injury here, it's going to take anywhere from 1 to 3 weeks to heal. In a grade 2, usually this will take about 4 to 6. And finally, in a grade 3, since you're getting that full rupture, sometimes surgery can be indicated and it can take upwards of several months. So essentially we're going to need to wait and see the results of that MRI to determine the severity of the injury and also to give us an accurate timetable for him to return. So I'll be on the lookout for any updates regarding Kendrick Bourne's case. If you happen to hear anything, please feel free to update everybody in the comment section below as well. So we wish him the best of luck moving forward. We hope along the lines of more of one of those lower grade MCL injuries and that there are no other structures involved. Thank you again for watching my content today. If you like this sort of thing, I'm going to go ahead and link another one of my playlists so that you can watch some more of those. Thanks once again for tuning in, and I'll see you next time.